Just going to give an update on numbers and details since we met yesterday. And then we have Ann Williamson, with the Executive Director with the Department of Human Services, who will talk about some of the new things that will be really the start of Phase 2. It's just the first part of Phase 2, and highlight some of those areas of that. And then we'll take some questions. We also have Justin Hoyle with Salt Lake County Sheriff's Department, and also Lana, Dalton with the Community Connection Center. We're here at the Community Connection Center because of really that outreach that has taken place with not only them, all the service providers in this area.
Well, thank you everyone for being here. What a week. Starting on Monday, this operation kicked off, and here we stand on Friday. And I think if you were to walk the streets, attend the park, you'll see a calm, and you'll see a change in this area that, frankly, as we were planning this, I didn't know that you would see as remarkable of a change for the better as we have seen. I think that it has been orderly. I am proud of how this operation has rolled out. And I think what I'm most proud of is our service providers are seeing those still coming to St. Vincent's, going to the road home in numbers that were similar, meaning that the people that truly need the care are receiving that care. What we're not seeing is the open air drug trade or drug market that's out there, and that's being dealt with. As anything, and knock on wood, we want this to continue to stay as orderly and as peaceful as it's been. And when you do that before and after contrast, it's hard to imagine how peaceful that's been. But it's important that the treatment side is beginning today, because something's happening out there right now. And what's happening is those that were very used to getting drugs at high quantities, because we looked for those high traffic drug users and were able to remove them. As that supply has gone down, you're finding some individuals who are becoming desperate in nature to be able to get those drugs. And so we're entering a phase where the treatment has to come in, and we have to be able to take people and bring them hope and dignity, one person at a time. That's what this phase is, and that's what's beginning today. It's not all, beginning to end, ready to roll out right now, but we are starting an incredibly important component, and it's coming at a time where those that truly need this help are feeling themselves that they need this help. So the rollout is as we had hoped, and it's absolutely essential that we see this happen, and the treatment side be as robust and as dedicated as we've seen the law enforcement side up until now. We have Commissioner Squires here that will give an update on some of the progress and the things that are going on. And then we'll have Ann, the Department of Health and Human Services, Ann Williams. She will give us an update on this treatment component that is rolling out starting today. And I'll have to give my mic to Commissioner Squires.
Thank you. Speaker Hughes, got it. Speaker Hughes, thank you very much, and we appreciate the continued support we are receiving. What's really important about having so many of our elected leaders come together on this is that it does allow us more opportunities to work on the fly, so to speak, as we see problems, being able to find those resources immediately, the attention that's been brought to this, including what Ann and her team and Lana bring. It's amazing. And so as our officers go through the area, they have opportunities to make sure they're enforcing the laws and making sure that we are creating a safe location for everybody. But also, if they see someone that is in true need of help and it's urgent, being able to have those resources that can get there with them, to have that expertise and be able to help somebody immediately. So that's huge for us. If we didn't have that resource behind us, our job would be much tougher. I want to start out today by making a point. Although part of what I've been doing the past few days is sharing with you arrest numbers, it's not about the numbers. For me, it's about the quality of the law enforcement that's taken place. And I've made it clear in my briefings with our troopers and with the other officers that I'm not pushing anybody to get numbers. I'm pushing to make sure that what we're doing in there is the right thing for the right reasons, and that we are doing it strategically and based on good information and quality police services. So that's the first thing I want to mention. We'll start out with yesterday's activity. We did have some changes, but we start out with the fact that 282 individuals were arrested, in custody arrests, and taken to jail total. Yesterday was felony arrest 22, warrant arrest 115, charges along with warrants was 104. We had 37 that were just charges that were booked into the jail. A lot of those would be Class B misdemeanors for various violations. Drug paraphernalia charges were 112. We did have a use of force incident last night. Was AP&P officers that were pursuing an individual who was fleeing from them on foot. They deployed their taser, and the individual had a minor injury as he fell, but he was treated before being taken to the Salt Lake County Jail. I also had an incident last night where one of our troopers was assaulted, and it was an individual that he had arrested, was placing into the patrol car, and the individual started kicked the door, and then kicked the trooper in the chest. The trooper's okay, but that additional charge was added when he was booked into jail for assault on a police officer. Again, I couldn't be more pleased with the way that our folks, along with Chief Brown, Salt Lake City officers, our AP&P agents that are partnered with us here, and our great partners at Salt Lake County Sheriff's Office, Unified PD, and then all of the law enforcement agencies working together, really trying to provide quality police services here that are for everyone and everyone's benefit. One thing that I'll also share with you, because it's a question that comes up, is what we are doing here, pushing problems elsewhere. I can assure you that from day one of our planning, we recognized that there would be people who would flee this area and try to still conduct criminal activity elsewhere. We also knew that some people would feel displaced for a while at least, and maybe move to other areas. We have been communicating with all of the police officials, chiefs, and agencies in the valley, as well as around the state, to try to share information as effectively as we can. And if there are problems, if it's related to what we're doing here, those agencies know to get that information to us so that we can track it. If they need our assistance, they'll let us know. Right now, they're all telling me that everything's manageable within the resources they have in their agencies, but they know that we're here to help them if they need it. That's it for now. I'll turn time over to Ann.
Just for clarification, that 282 was since the beginning of the operation. 53 arrests yesterday.
Thank you, Todd.
Good morning to you all, and thank you again to the speaker and to Commissioner Squires. The depth of partnership and appreciation of the humanitarian aspect of this operation has been committed, sincere, and focused since the start. And I'm so grateful for the professionals of the men and women who are part of Utah's Department of Human Services, who are arm in arm as we speak and have been since Monday with the city and county human service professionals as well. From the Community Connection Center, where we find ourselves here today, to the Road Home, Catholic Community Center, many other faith-based and community-based organizations who recognize the humanity and the individuality of the men and women who find themselves experiencing homelessness. So what we have recognized is the importance of shoring up our behavioral health expertise, our clinical expertise, relative to trauma that individuals experience, relative to the intensity of disabilities that one may be confronted with, in addition to misuse or abuse of substances that all compound to the instability of their housing needs. And therefore, the state, again, in partnership with the city and the county, are now ready to be very strategic and intentional to intensify our staff presence in the Rio Grande area, to intensify our partnerships, our strategic partnerships with county and city service providers throughout the region, and equally the state. Just as recently as this week, our state behavioral health administrators from throughout Utah have been at the same table agreeing to the shared resources that are going to be accessible and available when we assess an individual whose treatment needs are ready for intervention, because we do know of the importance of the individuality of these interventions to be most successful. These are men and women who are seeking and desire increased stability in their life, to address their addictions, to address their housing instability. And so we will continue, as you all are familiar with, working with the federal government as well, so that our treatment bed capacity can be significantly increased in the future weeks and months to come, because this is a commitment we have for the long haul, recognizing the importance of health, well-being, hope, and dignity, one individual at a time. So available for questions, and thank you to all.
All right, questions?
This can be for Speaker Hughes or Commissioner Squires. You mentioned the activity fleeing elsewhere. Speaker, you mentioned the calm that you see. So where are all those people going? We are getting reports that, for example, someone in Tooele says they've seen homeless people being banned up there and dropped off. Is that happening? Where are the people going?
So it's a great question, Glenn, and honestly, we knew that some people are calling it the spider web effect or the rippling effect. I know that, and Commissioner Squires can speak in more depth about this, we were prepared for this, and we understood it was intuitive that people would look for other areas to encamp or to try and stay away from where the attention might be. It's been our commitment to pursue that activity, that criminal activity, wherever it may go. And I said at the beginning, on Monday, if this migrates to Jordan River, we go to Jordan River. If it goes to West Valley City, we go to West Valley City. If it goes to South Salt Lake, we go to South Salt Lake. That is occurring, that is happening. But we do need, and I don't see it as a criticism, I appreciate the public's input. I appreciate that everybody has a camera and a video camera on their phone and can show us very specifically what they're worried is happening in their communities, because we need the conduit of communication to happen so that we can do what we have set out to do. That mission is integral to the success of what's happening. I will say we have to resist the temptation that any crime or any existence of homeless people started at the beginning of this operation. I've made the point, and it was a worry that I had before we started this, that if we didn't address what was happening here in this Rio Grande area, we were seeing the migration of the criminal nature to our public libraries, to our public parks, to our intersections where the panhandling is in actuality drug trafficking dollars and resources. It was traveling already. So we have that we all have to combat, but we are laser focused on making sure that this is not foisted to an adjacent jurisdiction or community.
But I've heard accusations from people in the community that they think that there's a coordinated effort within Operation Rio Grande who are intentionally moving homeless people out of this area and into other areas. Is that happening?
I can tell you from our plan and what's happening, that is not true. And the whole intention here was to create a safe environment here, but recognizing, like Speaker Hughes said, that some individuals are going to want to move out of this area as we come in here and start enforcing laws to a higher degree. And so it's not an attempt to move the problem somewhere else, and that's why when I just mentioned that it's so important for us to be partnered with every law enforcement agency in this valley and in this state, so that if there is something that is a problem that they need additional resources for, we'll get them there. And there was, I'll tell you this also, every report that gets to me, and a lot of them do, about a problem surfacing somewhere else, I have a team that goes out and looks at it and comes back and reports and assesses it, and that's through not just driving by, but talking to people and getting a feel for what's really happening there. Because we need to know, is this a problem, a law enforcement problem? Is it a treatment problem, social service problem? We need to know and understand that. And so that's the level of detail that's going into this operation and our efforts to be able to work with all the agencies.
Which areas have you identified where you're seeing some confirmed effects of this displacement? Where are you focusing on?
I'll be honest with you right now, the reports that are coming to me are of maybe some slight increases, but they're mostly in areas where they already had homeless issues. And so for me, that's just a matter of making sure that we are connected, that if there's somebody there that truly needs help, that we can get the right people there to them to offer those services.
You rousted the camps on 5th and 6th South, the health department did, maybe with your help. Are you going to roust the camps on the Jordan River?
I'll make it clear also that we do not roust. It's not a matter of going in and just messing up somebody's day or their life. If we're going in there, it's looking to see if there's criminal activity that's taking place. We're looking to see if somebody needs help. But if there's something that's happened in the Jordan River area, we're working with whatever police agency already has jurisdiction there, and as the river travels through various jurisdictions.
This is for Ann. Speaker Hughes mentioned that there are people that are desperate to get their fix because the drug dealers are gone and they need medical help or just some sort of help. Specifically, what is your agency, the Department of Health? What do you offer? Is it just strictly drug rehab? Is it detox? What are you getting?
Thank you. The need for the full range of human service intervention is absolutely present, from immediate crisis triage counseling to stabilizing that individual, evaluating the need for a detox intervention. We are working with our community-based partners, Volunteers of America, and many others. The state has worked to assure that we can quickly ramp up capacity through a variance on some regulations that still assure their health and safety, but allow more individuals to be able to access detox services.
What do you mean variance?
So that we can increase the capacity of individuals who can be served in the same space.
And may I speak to that for
Yes,
a
please.
second? This issue is so complex. I just want to point out, and maybe some of you realize, it's easier for government to be able to find capacity in jail beds because we're talking about government buildings. We're talking about government political subdivisions. The treatment beds are private providers, and some of those are literally being built as we speak. We have committed to the funds to make sure that they are, but there is some lead-up time that's required for a private provider to be able to get those beds online. We are much more nimble when we work well within government buildings and government jurisdictions. We depend so greatly on our private providers and their willingness, and they're ready to do this and get those treatment beds ready, but they have to have some inherent step-up time that government and jail beds just have not required.
So why start the law enforcement phase now while you're still in that lead-up phase?
I think it's thinning out. I think what you're seeing is what we're hoping to see is that the criminal element can't survive under the kind of scrutiny where we are trying to find out the individual stories of every single person, trying to, again, restore that hope and dignity to every person. When we do this, that criminal element, they're working on the other side trying to perpetuate this problem. When we begin that, they thin out, and we believe that those that truly need the treatment, or even the help at the Rio Grande, I've met many people who say, I need a place to go, but I wouldn't go there because of the criminal element that's been present in that facility. So what ends up happening is without the criminal, the crime enterprise or ecosystem that we have seen, without that being interrupted, some of the essential services that could be provided right now today have been a barrier for people that need help because of the fear of the criminal element. So we think that thins out this crowd. It helps us identify better those who are truly in need of help. And also we're seeing, as some people are not able to buy their drugs, that's starting to manifest itself out more where we can actually identify, they're more willing, I should say, to come and see and receive treatment because that supply line has been interrupted. So I think it's that phase 1 and phase 2, especially as we look 5 days in, I think it's having its desired effect. But if you waited for all those beds to be built, you know, we talked a big talk about this project. And if I said, we are hair on fire going to do this, we'll see you in 10 months. It not only was it not practical given the carnage and the escalating crime that was occurring, but we thought we had a better plan than that, where we could really start to thin out and interrupt that ecosystem of crime. And so I do think it's stepping along in the best way possible.
Given that you don't rouse, you did, I guess what you did was you posted 5th and 6th South, and then the health department either moved them or they moved before the health department got there. I don't know which. Let's call that moving them along with understanding how compassionate you guys are. Are you going to move along the camps on the Jordan River that have been there before and that may have grown, I don't know, or the camps elsewhere? Are we going to see an end to homeless camps in the area?
Are we going to see an end to homeless camps in the area based on our actions? I can tell you that I don't have a crystal ball that will tell you how this will play out. I do have the knowledge of the fact that the resources that we have available to us right now. I know that also we don't want to put somebody in a situation that's worse than they are right now. And so every situation, every arrest, every need for treatment that the officers encounter is different. And so having that ability now for them to have the resources of social services, of mental health, to be able to identify that and not have that pressure of feeling that they have to go in and just arrest a bunch of people is what the luxury of this operation is.
Last question. Back to Ann.
Okay.
Well, see, being that you guys didn't get the beds that you needed, are you seeing a backlog of people who kind of need treatment? Is there a line, a waiting list, or are you able to handle them all?
Our communities are filled with individuals whose individualized needs range from desiring treatment that they right now need to wait for, to needing a crisis counselor that they now have the ability to access. In partnership with Lana, Dalton, and the Community Connection Center, we have long identified individuals who have said, when treatment beds are available, I would like to be able to be serviced in that way. But you can help me with the stability and safety and security of my life until that bed is open. So that existed before this week. The mission of the Department of Human Services and throughout the counties and cities for years has been a commitment to triage and address crisis, substance use disorder treatment, mental health, illness in the most effective way possible with the multi-sector layers of services that we have. Let me specifically, though, note that what the focus on this has allowed is, for example, we had many individuals this week who we helped whose principal needs are that of intellectual disabilities or developmental disabilities, simultaneous with mental health needs and substance use disorder treatment needs. And we have been able to bring to bear added resources because of the complex individual case management that we've been able to attend to, and that will be ongoing.
Is there a backlog though? Are you keeping up with the amount of people coming in?
I don't want to represent for Lana. My understanding is that we do have individualized identification.
Yeah, we do have individuals currently that would like to access treatment. However, what we are doing is we have been able to expand our Volunteers of America detox slightly so we can get those individuals that are waiting currently into some sort of service. And I want to reflect what Ann has said as well. These individuals, they're human beings, and everyone has complex needs, yourself, myself, everyone. And so you have to take that into account. It's not just a treatment bed that someone needs. There's a whole well-rounded approach that has to be taken to each person.
And that's what this mission is acting.
Are you able to help more people today than you were able to help earlier this week or last week? Are there more resources
In this
available
community,
right now?
absolutely, the answer is yes.
Yes. How much?
I'm sorry, did the
Well, I
speaker
don't
want
know
to?
how much, but I wonder.
Well, sorry.
We're not, as the commissioner said, we're not counting this by number. I mean, this is a multi-layered, multi-sector operation. What we know we're doing is attending to the needs of the individuals who have come to our attention. We have not had to turn anyone away.
Let me just
Final
say-
statement with the speaker.
Let me just say this, and I just want to be clear, because some of those questions, I think you're almost set up for failure when you answer them. This operation will not eliminate the need for treatment beds or be able to keep up with the pace of the addiction that we're seeing nationally. There is an opioid crisis that when I meet with speakers of the House across this country, they are seeing numbers of addiction that have never been seen before. 4 out of 5 heroin buyers in this state, in this area, started with prescription drugs. To say that this operation is going to solve that issue and that every bed will be there for this growing number that we see coming into our state of Utah, and not just in this area here, we don't want to leave you with that impression. What we do want to say is we know and we have the resources and we have looked at how we can provide a more robust level of treatment and help for those that need it. You can't arrest your way out, but you can't forget the treatment side either. There is a combination of effort going on here with law enforcement attacking that ecosystem of crime and drug trafficking, but as well ramping up as quickly as we can the treatment beds. I've been warned, because this isn't a space I'm used to. Don't think the first time someone darkens the door of a treatment center, they're cured. They may leave and relapse very quickly. It may take multiple times for just one individual person for it to click and for them to be able to recover. So the expectations are, and this effort is to make it a more robust effort and really get to people who need help. Will we solve it? No, I think this issue is so complex and it is so big and it is impacting this whole state as well as country that this effort here will not end the need for treatment beds or the need for helping people that find themselves in the throes of addiction. It's a troubling issue that we are going to be taking on. We have a Attorney General Reyes has a task force that we're working on. We've worked with the DEA and Special Agent in charge of Utah, Agent Besser, on we've got a critical DEA 360 national grant to help step up our efforts on the drug trafficking on the higher level. So it's a big and it's a complex effort that we're engaged in, and this is just one part of that.
Thank you, everyone.
It's definitely been able to bring partnerships on board that we may not have had prior, which has been excellent, so we could expand services out into the community and help those individuals that we may not see in this area or may have left this area to re-engage them in services. By having the Department of Workforce Services here, the Road Homes Client Engagement Team and Case Management Team, Volunteers of America come on board. It's been a really great, robust system to offer individuals individualized care and continue with our mission. We triage individuals regularly on a regular basis that are in crisis. However, with this additional capacity and with our team out in the field, we can do some clearing in the field as well, so we can maybe divert and avoid going to places like jail or hospital emergency rooms, things like that, and get them to other services in the community that are made for individuals that are in crisis but may not need those services. So they use a lot of different evidence-based techniques in order to engage an individual, because we have clinicians and caseworkers on staff. A lot of it is just coming from a caring and compassionate place of, how can I help you today? We know that this is stressful. We know that this is, out of the norm for you, and how can we take that and help you move forward and do something different so you're not having to experience this on a daily basis. I have had individuals come into my office just sobbing because they're so thankful that they can feel safe in this area and access what they need to access. People are extremely excited for the ramping up of additional substance use disorder treatment in the community, and because I think that's necessary and needed and has been needed for a while, and with this effort I think it's been able to shine a light on that and bring those necessary resources to the table. Sure, so this week we've had approximately 240 clients that have walked in, and we've been able to outreach to 54 different locations. That doesn't mean people, that means that we've been called out from dispatch to 54 locations to help either a person or a group of individuals.